is with immense pleasure and deep sense of responsibility I welcome you all to this historic Safe Passage Summit. Today we gather not merely as representatives of institutions, but as advocates for human dignity, equity, and justice. This summit provides an invaluable platform to reflect on our progress, share lessons learned, strengthen partnership, and identify practical solutions to existing challenges. It offers an opportunity for governments, civil society organizations, humanitarian actors, donors, and affected communities to engage in meaningful dialogue and develop actionable commitments that will improve the lives of vulnerable populations.
In a world where mobility is increasingly shaped by conflict, climate change, and socioeconomic pressure, the Safe Passage initiative remains both timely and essential. This program continues to stand as a critical humanitarian response, ensuring that migrants, including refugees, asylum seekers, internally displaced persons, and other people on the move, are not left behind in accessing life-saving, right-based, and inclusive sexual and reproductive health services. It is therefore my pleasure to extend this goodwill message on the occasion of the Safe Passage Program Summit, bringing together a distinguished gathering of stakeholders from UNFPA, government institutions, International Planned Parenthood Federation, Planned Parenthood Federation of Nigeria, and other international NGOs committed to advancing sexual and reproductive health and rights for population on the move.
Civil society organizations are doing a work that will complement that of the government. And of course, you agree with me that there are certain things that those people in the government, because of the bureaucracy and because of the hierarchy, may not bring them out for the government to tackle. This is where the civil society comes in. And of course, what they do and the data they bring out all will help the government in formulating policies that will enhance sexual reproductive health in the country.
I would like to commend the Planned Parenthood Federation of Nigeria, the International Planned Parenthood Federation, and all implementing partners for their dedication to addressing the unique health challenge faced by vulnerable populations across migration pathways.
I'm pleased to convey our goodwill message and solidarity to PPFN as they convene the Safe Passage Project Summit. We stand fully behind the summit objective and pray for impactful discussion and outstanding outcomes.
Federal Ministry of Youth, we are happy to collaborate to partner with the Planned Parenthood Federation of Nigeria, and we hope that with collaboration with this Planned Parenthood, we'll be able to at least make our young people, give them the opportunity to have safe sexual reproductive health rights.
So I would like to confirm you that Ethiopia is ready to work with this organization and other similars in solving all the African problems that we have. The responsibility is with us. And solving such problems of mothers, sisters, and of anyone should not be ignored, should not be aligned with another issues. It should be a priority of every country. In this regard, the Embassy of Ethiopia and as a country, we are ready to work with you, and I wish you a very productive presentation and meeting. Thank you.
IRC welcomes the opportunity to contribute to the Safe Passage Project Summit and to join government, development partners, and civil society organizations in advancing sexual reproductive health rights for populations on the move. IRC has got one simple but powerful principle. No woman, no girl should lose access to life-saving SRH services because of displacement or living in fragile settings.
Why do we have Safe Passage projects? It's here to bridge the gap in healthcare services along the migration routes. It's also here to respond to critical humanitarian needs of people on the move, as well as aligning the intervention with International Planned Parenthood Federation's priorities. as well as targeting the most invincible population.
We gather at a time when human mobility has become one of the defining realities of our world. Across borders and within regions, millions of people are on the move, driven by conflict, economic hardship, climate change, insecurity, and search for safety and dignity. Among them are migrants, refugees, and people on the move. Yet within this movement, one essential need remains constant and too often unmet: access to SRH and R services.
According to UN data, 1.4 million international migrants live in Nigeria as at 2024, and 2 million Nigerians live abroad. You can see that. And 140,000 refugees are hosted in Nigeria, mainly from Cameroon. Nigeria represents 3.5% of the world 117 million forcibly displaced people. Women and girls represent nearly half of the displaced population globally, with higher exposure to violence, exploitation, and lack of shelter.
When we look at all the countries here present, I regret to say that despite all the efforts over the years, the SRH data is in superlative. Highest population growth rates, highest maternal mortality ratio, a lot of unplanned, unwanted pregnancies that are terminated. Some of these girls dying in the process. If they survive the illegal abortion, they have compromised fertility, and infertility in some regions of Africa are a major reproductive health problem.
What we've seen working with women and girls, particularly at internally displaced persons camps, is that there's socio-cultural barriers. So with the socio-cultural barriers, a lot of myths and misconceptions. So particularly when we speak about family planning, for most of them, they do not have adequate and accurate information about what to do. So even when they want to prevent pregnancy, they do not know what to do, how to do, or they've been fed with so many myths and they're actually afraid rather than being proactive.
Individuals with substance use disorders face systemic barriers and sometimes punitive legal frameworks. This limits their access to safe reproductive care, voluntary contraception, and maternal support programs.
For a pregnant woman, fleeing violence displacement does not pause pregnancy. For an adolescent girl, crossing border mobility does not reduce the risk of gender-based violence. And for a survivor of rape in a humanitarian setting, movement does not diminish the need for life-saving clinical care and psychological support. The reality is simple. Sexual and reproductive health and rights do not stop when people move. Yet, too often, health systems, humanitarian responses, and migration policies are not designed to adequately respond to these needs.
In those countries, we call them developed countries. They have very good budgets for their health system. But in Nigeria and other African countries, I could remember in 2001, I read about Abuja Declaration, where African heads of states, their ministries of health, said that the budget of African countries should be 15% goes to the health. I can't recall any time Nigeria, for example, budgets 15% of the budget to the health, because it is the scarcity of that fund that is causing what Madam was talking about. There's poor funding.
Across the world, millions of people are displaced by conflict, economic hardship, climate change, persecution, and humanitarian crisis. The Safe Passage Project was established in recognition of these realities, implemented across 8 countries: Nigeria, Morocco, Sudan, Cameroon, Tunisia, Mauritania, Ethiopia, and Niger.
The Safe Passage Project challenges us to think differently. It challenges us to move beyond fragmented programming towards integrated system. It challenges us to place dignity, equity, and right at the center of our response to migration and displacement.
These challenges demand coordinated, innovative, and compassionate responses.
I encourage all participants to contribute openly share innovative ideas, and identify practical actions that can strengthen service delivery, improve coordination, and enhance accountability.
Most of these people on the move or IDPs are inside the states, communities in the states. So if they get involved in the National Health Insurance Scheme, if they get enrolled, that scheme will take care of the people on the move, as we call them, or the IDP camps, or the asylum seekers, as we call them.
Taking services to our women, to our young people, at the comfort of their homes, where they live, because this reduces the barrier of transportation, of costs as well. And one of this is the self-care intervention in family planning, where the woman doesn't necessarily have to attend or visit the healthcare facility. What we do is train women who live with them in their communities, who pick up these commodities from facilities and take them to the women, either at their shops or in their houses.
Another thing is also engaging men and boys and even traditional and religious leaders, because without this, we're not able to dispel the myth and misconception, garner their support, and make sure they have access to. One very important one is organizing safe spaces for them. So within the safe spaces, they're able to learn negotiation skills, communication skills, but also understand key information about health. And we make referrals. So with that, a girl knows what to do when she is in a situation.
We're in 36 states and FCT, and we're in the 774 local government of Nigeria. So we leverage on this structure to talk to women at the grassroots, tell them about their reproductive health, tell them about even GBV, because you can see that most GBV happens at the grassroots, and those of us in the at the urban centers will know where to go when we have issues, but these people at the grassroots, they don't know what to do. So we try as much as possible to tell them that you don't just have to keep quiet. Even in the schools, we have carried so many advocacies at secondary schools, just to tell them that you have a place to go, you have legal aid, you have feeder, there are so many agencies where they can talk to.
We have a very critical role around awareness creation, ensuring that people understand that what injustice done to one is an injustice done to all. Ensuring that our communities are aware and understand the negative implication of gender-based violence, and that any one of us can be a victim of GBV.
I'm sure you people are aware that there are about 21 states now who have sexual assault referral centers where this integration of GBV things can happen. At least I was part of training all in those states. Now you go there, you have an integration of services in terms of healthcare, sexual and reproductive health services. You have psychosocial counseling, and then also doctors and nurses are trained to correct forensic medical information so that we will be able to successfully prosecute the assailants when it comes to issues of rape. So, and I completely agree with you. Most people don't even know this exists. I'm sure if I ask people in the room here, do you know that it exists in Abuja? Most people don't know. So awareness must be created. Thank you very much for that.
When policies and reforms are made, we should be able to involve people who live these realities, especially youth, since we make up the most population of Nigeria. We should be able to include youths, not just beyond tokenism, photographs and just beautiful sceneries.
My name is Liatsu Ayuba. I'm born in Borno State, Chibok local government. My husband is a mobile police officer. The issue of Boko Haram brought my husband to Maiduguri, from Maiduguri to Bama local government. From there, my husband called me, said, I'm rest in peace. I said, what is going on? What is going on? What is going on? He cannot speak again. Before I know, they just come and meet me. Madam, prepare. Boko, Taliban shoot your husband. Husband leg break. We took him to village. You go and stay with him. I say, wow, this is not truth. My husband is die. My husband is die. So from there, they just took me. Before I know, they gathered all my children, put it in car. I went there. I just see my husband lying hopeless, died in grave. They didn't put his son. They opened the box. I saw my husband. I just see cry.
May we just stand up for 1 minute in respect of the late husband. They give him 1 minute silence.
In my camp, I'm delivering the women. So in the clinic, nothing in the clinic. We need the challenges. We have to stop those women to deliver anyhow because we don't have enough food, and even we are not working. So in the clinic, we don't have like pills, condom, like depot injection for the clinic to insist the women to take it. We need people to come and education to the women, because the women, they don't want to take the family planning. They are saying that they kill all our children in Boko Haram. So some of the women, they get like 5 children, all of them die. They say, why mommy, you are telling us that we do family planning? So they don't understand what is family going. So we are pleading for some people, for anybody, let them come to the camp and give them the education, the knowledge, and the good and better for the family planning.
You know that we have monitoring tools, the NHMIS. So we're using the data that is being gathered to make informed decision, and then each of the agencies working together, trying to ensure that we address whatever gaps they arise. But the truth is, it doesn't lie with only us from federal. The states have a major role to play. And one of the roles they have to play is also to ensure that they support in bringing their own counterpart funds when needed, and they also have to make their own procurements when needed.
There's a need for budget release, because with this release of budget, there is procurement of commodities, and this will prevent stock out of commodities. So once the government is able to allocate money for procurement and they purchase these commodities, the woman who lives in Borno State, who lives in Zamfara, who lives in Nasarawa in Nasarawa State, is able to get adequate services that would enhance her sexual and reproductive health and rights.
Due to the unending challenges that substance use poses, the NDLEA, in partnership with other relevant agencies like the Planned Parenthood Federation of Nigeria, encourage families and individuals to promote a safer, healthier environment and society through the following programs. The NDLEA Drug Integrity Test for early identification and intervention. The Needle and Syringe Program, NSP, for drug injecting users. The HIV testing and counseling treatment. Antiretroviral therapy treatment.
As member associations of the International Planned Parenthood Federation, PPFN remains committed to ensuring that no one is left behind. Through the Safe Passage project, we are strengthening service delivery, expanding access to contraception, maternal health care, HIV prevention and treatment services, psychosocial support, and protection from gender-based violence. We are also working to build stronger referral system, foster cross-border collaboration, and advocate for policies that uphold the health and rights of people on the move.
The collaboration reflected in this summit demonstrates the power of collective action in translating global commitment into real, accessible services for vulnerable population. We also commend the ongoing contributions of government counterparts and civil society partners who continue to strengthen referral pathways, service delivery systems, and community-based protection mechanisms that make the Safe Passage vision achievable. As this summit unfolds, we hope it further deepens shared learning, strengthens cross-border referral system, and enhance sustainable financing and accountability mechanism that will continue to improve outcomes for those most in need. Please accept our sincere appreciation for your leadership and commitment to Humanitarian SRHR.
Behind every statistic is human story. a young woman seeking maternal health care, an adolescent in need of information and protection, a survivor of gender-based violence requiring support, or a family searching for a safety and hope. Let us work towards creating systems that are inclusive, responsive, and accessible. Let us strengthen policies that protect the rights of migrants and refugees. Let us invest in innovative approaches that ensure continuity of care across borders. And above all, let us reaffirm our commitment to the principle that access to sexual and reproductive health care is a fundamental human right.